With Dr. Darren Candow here. Just give me a little bit of background about yourself, your
Yeah.
research, and how did you get into creatine?
Yeah, it's kind of a familiar theme. Most academics always by chance, right? So I did an undergrad degree in cell biology, and it was very fascinating. But at the time, I was working out, and I wasn't really getting a lot of information on the benefits of nutrition with exercise until I took an exercise physiology class, and my career pivoted. I started to understand the importance of post-exercise nutrition, and by doing that, I started to add on more muscle mass and strength. So I totally switched gears, went from biology to kinesiology. And during my master's, very interesting, you'll probably find this humorous. I did my master's on glutamine. Now, at the time, glutamine was extremely popular, not only for sort of people in the gym, but also for marathon individuals and long-term cardio. And we gave about 45 grams of glutamine for during 6 weeks of intense weight training, and it did nothing. We concluded it was essentially worthless. And it kind of makes sense now when we have more information that it's a non-essential amino acid. You need all the other 19. But at the same time, I had a really good colleague, Dr. Darren Burke, who was in a supplement industry, and he's still pioneering in those areas. And he was doing creatine. And at that time, he was finding some really good results. People were getting bigger, stronger, faster. And it's sort of, I pivoted and I've been focused on about 20 years now looking at creatine, which has even evolved from athletes. And now we're starting to look at clinical populations, and we're starting to look at brain function and bone and female health. So it's really been an interesting transition, and I'm very fortunate to be part of it.
So 20 years ago, what year are you talking about when you're getting into it?
2001, we started to look at the glutamine, and then right about the same time was the first publication we did on creatine. And in 1992, Roger Harris, anybody familiar with creatine has read that study, and that's when those came out. So, there was a decade lag. We thought we knew everything, kind of went away. This boring white powder we thought we knew everything about, and now it's a resurgent. It's probably more popular almost than caffeine and protein right now, just potentially for the health aspects that we're starting to see, which is very fascinating.
So I think there's nobody better to explain, I guess, like for our audience, how
Mhm.
does creatine work? What is the mechanism of action? Why is it beneficial? What's the main thing that it's doing and how it gives us benefit?
So for your listeners, we're all synthesizing creatine. It's a nitrogen-containing compound. It's similar to an amino acid, and we're producing it in the brain as well as the liver. So that's a very interesting facet. Now, when we produce it, we are producing only about 1 to 3 grams per day, but we also consume it in the diet through red meat, seafood, and poultry. And we excrete a small amount through creatinine. So if anybody's gone to their medical practitioner and they've seen creatinine measured on their blood requisition, but the whole theory, it was discovered for ATP, the main energy currency of our cell. And all it does is it sacrifices itself to maintain energy in the cell, i.e. muscle, during exercise. So it's well purported that the main mechanism of action is to maintain high intensity phosphate kinetics. In other words, if you're in an anaerobic sport, sprinting, weightlifting, things like that, it will allow you to exercise at a higher capacity. And then over time, you may get bigger, stronger, faster. So that's the most established mechanism. But there's other now that are starting to emerge. We now know that it has a lot of mechanisms from a cellular perspective in the muscle. It actually has the same or very similar mechanisms in the bone cell. And then the brain is quite fascinating, where it seems to reduce oxidative stress. So sleep deprivation, clinical depression or anxiety, concussion. These are all common denominators where they have reduced creatine stores in the brain or heightened inflammation. It's kind of like taking an Advil or Tylenol. Creatine seems to have some of those properties. So I think that's why it's so fascinating to have an increase in potential recovery, but also some of these anabolic effects for a lot of exercising individuals, not just athletes, but exercising individuals or those heightened to metabolic stress, which is pretty much everybody on the planet, poor sleep, not having enough time to exercise. So that's why it's sort of taking on a new life of its own.
So I feel like in a lot of different domains, whether it's like even like when the ketogenic diet got popular, even in researching, say, like even glucose, a
Yes.
lot of the benefit is creation of energy, right? So even in brain health, like when people start talking about ketones and brain health, a lot of that is because maybe it struggles to get glucose into the brain and have energy. So just by helping something create energy. So
Yeah.
is that the primary mechanism of what it's doing
Yeah,
for?
That is a primary mechanism that most support it, especially from a muscle perspective. Bone and brain is more the opposite. It's more of an energy perspective for bone, but more maybe anti-inflammatory. But you're right, even in the brain, if the brain uses 20% of our energy each day. And when you're stressed, you haven't eaten, long flights to Europe, jet lag, that's when the creatine seems to have some favorable effects. And to that, the counter argument is if I have adequate food, proper sleep, you may not even notice any big benefits from creatine, at least from a cognitive perspective, but from a muscle, depending on your diet, vegans versus omnivores versus carnivores, there's a big difference. Yeah.
The fact of being in excess or deficiency.
Mm-hmm.
So it seems like things that you've said is that creatine is stressor stimulated or triggered. So doing exercise, being stressed, not sleeping enough, that's when you're starting to really see the benefits of creatine. Whereas if you're already, say, someone like me, I eat a lot of red meat. If I'm healthy already, would that person see as big of a benefit? And what are some of those triggers that need to kind of get it to work or to bring it about?
Yeah, the number one factor that determines if it works is your initial creatine stores in your cells. So, for example, as you just mentioned, if you're eating red meat and seafood on a daily basis, multiple times a day, it's highly likely you're not going to respond to the powdered supplement because you're already getting enough. And that's why we see phenomenal increases in muscle mass and performance with vegans and vegetarians. So, for example, if your living room is 3/4 full of creatine, if you're on an omnivore diet, vegans and vegetarians is only half full. So therefore, they can actually put more creatine in through supplementation and respond. Whereas a carnivore, it's highly unlikely they would get any benefits because they're probably taking 5 grams or more through their diet. And that's a really good dose from at least a muscle perspective. If you're metabolically stressing from a cognitive perspective, you might need a bit more. But non-responders and responders are primarily dictated by your initial creatine stores.
What about cooking red meat? Does that destroy the creatine in it?
It actually makes it a little bit more bioavailable, just like protein. So the cool thing with creatine, it can go through your hydrochloric acid in the stomach remaining intact. So if you do cook red meat at high temperatures, it could denature the molecule a little bit. But there's actually been studies shown by Roger Harris that meat or creatine in beef or meat extract is intact. So unlike protein, where you sort of denature the egg, it might get it a little bit into plasma a little bit easier. The efficacy is still there, but it is slightly reduced compared to consuming it powder in yogurt or powder in solution. Yeah. So heat
Okay.
definitely does denature it a little bit.
Before we get into some of the more common risks that always come up, is there anything with the long-term use in the sense of, I'll bring up the glucose example again. If someone's deficient in glucose and you give them some, they're going to perform way better.
Right.
But if you give them too much, they could become diabetic and cause insulin resistance. Is there any relation to long-term use and oversaturating the body with creatine that you would, worry about in the future if someone was taking it for a lifetime?
The theory is there, it's just never been shown, and I'll sort of justify why the theory is there. So it's kind of like glucose, you keep dumping in glucose, you get insulin resistance. Well, there's a theory that if you keep dumping in high amounts of creatine, that your muscles becomes totally saturated. Therefore, if there's no other room for creatine to go in your muscle, where does it go? It's very logical that if you take high dose creatine for long periods of time, you're going to get an increase in urinary creatinine and urinary creatine. But our new line of thinking is, wait, what about the brain and bone? Maybe some of that would trickle into those demanding tissues and actually have some beneficial effects over time. So that's something to consider from a long-term perspective.
I think it was you that made a comparison to protein, where you
Yes.
think of consuming creatine the same way as if you're consuming protein, like
Mm,
up a few grams or down isn't going to be problematic to your health. Your body can consume and
right.
use protein, excrete it. Is that a fair analogy if someone had a lifetime use or long-term use?
Yeah, it is a really, really important thing. So the safety profile of creatine is very, very elegant. It's very similar to protein and caffeine. And when you take in too much protein or creatine, obviously you excrete some in the urine. And that's why it's so recognized and probably the safety profile is so good there. So at the end of it, if you're taking in too much and it's not being used, you will excrete it. But again, the dose of creatine needed is so, so small compared to the amount of protein.
Before we, like I said, we get into common things, one thing that I've always wondered.
Yeah.
So are you familiar with the metabolic, I know you're familiar with it, the metabolic theory of like cancer, where glucose
Yes.
is
Yes.
the
Yep.
cell.
Yep.
And I think Thomas Seyfried has become quite popular now over the last 5, 10 years. Is that mechanism in any way, being that creatine is kind of anaerobic, in any way possible or a fear that if someone had tumor, that creatine could promote tumor growth? Or is that just doesn't make sense?
Yes, so we're actually writing part two of this big myths paper, and Mark Tarnopolsky, who's one of the world's leading researchers, medical doctor, he's looking at the creatine and cancer section. And actually, the majority of evidence vastly supports an anti-tumor growth or anti-malignant effects of creatine, primarily from its anti-inflammatory perspectives. There's been a few studies at a super physiological dose on tumors in rodents, and that has been shown to have some chance of tumor growth. But in humans or the available evidence, we're not seeing any of the effects. So as it currently stands, again, I'm not a medical doctor, and I don't want to, if anybody's listening with cancer or chance of it, please don't take my advice. Please talk to your oncologist or medical practitioner. But the good reviews are suggesting it has some anti-cancer properties, primarily based on those anti-inflammatory effects.
Okay, and I think I always wondered more from like a I'm living my life. I don't know I have cancer, and yet I'm taking creatine. You find out, oh my God, I've been feeding it for years, or maybe but that was the question. So let's get into some of the risks that people bring up commonly. We'll demyth these real quick. Hair loss. People talk about that because of, I guess I think that's tied to a paper a while back that there's not much support for, but I guess you can explain it a little better.
And of course, when they look at me, they're like, "Oh, it must." So
yeah, me and you aren't doing too good right now.
yeah, it's this. It's fantastic because it always spurs discussion. But it was one study in rugby players when they took a loading phase, which is 20 grams a day for 7 days. So very commonly recommended on supplement labels or for athletes. These individuals actually got an increase in DHT, which is a hormone or derivative from testosterone. And when you go back to your biology textbooks, an increase in DHT could be linked to hair follicle loss and thinning. But they measured it in serum. From a cellular perspective, it didn't really correlate well with hair loss or thinning because they never measured it. And when they actually measured the amount that went up, it was in your normal reference range. So when you go to your doctor and get cholesterol assessed, it has a range. And when they looked at it in placebo, the levels didn't go up. So everybody read it and said, oh God, this hormone went up. It must cause all the hair loss. I never want to try creatine supplementation. I think the best way to answer this is we don't know. There's never been a study to show emphatically that creatine does or does not cause hair follicle thinning or baldness. I do answer it another way. I've assessed over 1,000 people, males and females across the age spectrum. And not once has some come to me and say, Dr. Candow, whatever you're giving me is causing my hair to thin. Now, that is anecdotal and subjective, but there's no evidence to suggest it definitely causes baldness. But that study actually has to be done before we emphatically can dispute it.
Any issues or risks associated with medications, interaction with different nutrients? Can it deplete nutrients? Like, sometimes if you take high dose of protein, it can deplete other nutrients. High blood pressure and obviously digestive distress. I know we can get into that a little more, but anything that it's known to kind of be problematic or exacerbate?
Yeah, currently, no. One of the cautions is that anybody's on an anticoagulant or blood thinner, some can influence water retention in the plasma. Creatine is osmotic, so it'll take a little bit of blood into the cell, so that can fluctuate some of the things in the plasma. But there's no big interaction with other medications that we're aware of. If someone is on medication, please talk to your doctor to make sure. But where it's a hydrophilic molecule and we naturally synthesize it, there's no big interactions. Some people have a little bit of caution with NSAIDs, but the logic there is not really substantially supported.
It doesn't deplete anything? Like
Nothing
if you're taking
per
high
se.
doses of, okay.
No, because the big thing is it's non-essential and essential amino acids. If anything, it has a synergistic effect when you combine it with protein. So for those listening, if you have creatine and protein, you kind of get a greater increase in performance and muscle mass, probably because they're two anabolic agents that can give you a small greater effect off of weight training.
I know bloating or digestive distress could be problematic, especially in high doses or if people do the loading phase. So there's different ways, obviously. People can load it for a week or people can like take a smaller amount consistently until they saturate the muscle. But with that digestive stress, is it mainly because of water being pulled in or is there something else to it?
Yeah, it's mainly due to the dose, we think. So that when you look at all the studies, it's typically only occurs during the loading phase, which is 20 grams a day for 7 days. Now, if we go back to how much we're producing in the liver, it's only about 1 to 2 grams. So 10 times that amount would probably have an adverse effect. And what we think is it can cause GI tract irritation or some water retention into the cell. But when we take a lower dose, we don't see any real good evidence that suggests any adverse effects, including acute water retention, bloating, or weight gain. So we can talk about dosing, and it is quite interesting. We have a really good paper coming out shortly making the case that maybe muscle, bone, and brain require different dosages. But then to the human, how do you get 3 separate dosages? I take 10 grams a day to sort of hit the whole body, but someone starting out certainly doesn't need that much. And maybe people are listening say, I only want it from a muscle perspective. What if you only want it from a brain perspective? The dose may be different depending on the tissues.
And to conclude the digestive distress thing, for people with SIBO, leaky gut, intestinal permeability, things like that, any interaction, does it improve or hurt? Like you brought up glutamine earlier. Glutamine is obviously a known amino acid to help improve the digestive tract. What about creatine in that regard? Any issues?
Yeah, we've seen some actually beneficial effects on IBS from studies out of Europe. And I think it's due to the anti-inflammatory response. So this is a nice segue. I think you're going to get a lot of questions, and I do, about, hey, I'm curious about creatine supplementation. Should I, go by what's a lot of athletes? And I say, you know what? From a muscle perspective, start as little as 3 grams a day, but divide that 3 grams up into 2 1.5-gram dosages in the morning and evening. Mix it in water or with food, and you're probably not going to get any adverse effects whatsoever. And then once you feel, hey, I'm good to go, increase it to 5 and slowly increase it up if you want. I like spreading it out because we're doing some studies right now where we think that more frequent, smaller dosages will cause greater retention in the muscle, and therefore you're going to have less excreted, and you may get some beneficial effects. It's kind of like the protein theory, with protein pacing throughout the day might give you greater beneficial effects. We don't know that, but that's the theory.
Now let's get into some of these benefits beyond athletes that we've kind of alluded to. Specifically, we have a couple of women's gyms.
Yes.
We have a nutritional product that we have a lot of women members, so it's a topic. I've probably read more books on menopause than most men would ever like to read. So some common things that come up a lot, we're talking about bone density, bloating, perimenopausal symptoms. I know you've done a lot of research on that. I think you even did a long-term or 2-year study where they super high dosed women. What benefits are you seeing with women and women's health, and what did you see in that research?
Yeah, it's so phenomenal because females across the lifespan are so underrepresented, and it's a great population to target from many perspectives. But from a younger female perspective, 18 and above, we're seeing great improvements in muscle performance, so strength, endurance, and power. Females do increase lean tissue mass, but not the same magnitude as males. We're not sure exactly why, but we think the cessation of estrogen or estrogen itself may play a role. They do respond favorably, but not to the same magnitude.
Okay.
But interestingly, when we get into the postmenopausal years, so your mom or grandmother, whoever it is, where they're already having accelerated rates of bone loss, they really seem to respond to creatine and exercise at higher dosages. So that paper you just talked about, we gave 11 grams of creatine monohydrate daily for 2 straight years with weight training and walking. And the females on creatine had an improvement in bone geometry and strength around the hip. That's really important from a clinical perspective. If you suffer any fracture or falls and you need hip replacement surgery, then you're inactive for over a year. So that is really, really important. We don't know if that would have the same magnitude of response in healthy young females or during the perimenopausal transition. And that's what we're hoping to look at down the road.
The number one thing that comes up, even one of my members asked me to ask you, is specifically they've noticed, they feel like, that the bloating on creatine, and almost even systemically a little bit throughout the body.
Right.
Is that a thing? Do you see that clinically?
Yeah, we actually saw it a lot in the initial stages because we made the error of doing the loading phase. So we've sort of got away from that to look at the relative size of the person. So we usually base it on 0.1 to 0.14 grams per kilogram. So on average, if you're 70 kilograms, you're taking anywhere between 7 to 10 grams a day, and you can split that up as much as you like. The timing of creatine is irrelevant. Or you can start as little as 3 to 5 grams a day and go from there. I will say from a bone health perspective, and again, this is primarily in aging adults, the lowest dose is about 8 grams a day that have shown to have some favorable effects. We haven't seen any benefits at lower than that with or without exercise.
Brain health and aging, I guess, what are you guys finding there, and what research is going on right now? I've even seen things in the past like related to Parkinson's and all sorts of different brain injuries, concussions you brought up.
So collectively, from an aging standpoint, there's very, very minimal evidence. We've done a meta-analysis to show it did prove aspects of memory and cognition. But we're not seeing any big benefits for Parkinson's, Huntington's, ALS. We don't know the effects yet on Alzheimer's. There is a pilot study out of Kansas that's looking at that now. It has been shown to have some beneficial effects for muscular dystrophy, but that's in young boys. Multiple sclerosis, it had no effect. The common denominator with all those trials, the sample size was extremely low. And to see any magnitude of effect, you would need large multi-center trials. There's been one study in children on concussion where they gave a high dose, 0.4 grams per kilogram, so about 25 grams. And that seemed to improve the recovery symptoms of concussion, but it hasn't been replicated in adults, probably because they're already on creatine, or we need to do a large term trial there. The biggest weight of evidence from the neck up seems to be on sleep deprivation. So adults who are sleep deprived, when they perform cognitive or memory tasks, seem to improve on creatine versus placebo. So hypothetically, jet lag comes into mind, or hypoxia. The second half of the soccer gold medal match at the Olympic, maybe that's where this could play a role when the person's really fatigued. What happens, game 7 of the Stanley Cup Finals and they had poor sleep? Could this play a role? Those are the areas I think you're going to see in the next 10 to 15 years. The brain uses creatine just like muscle, but unlike muscle, which acts as a vacuum and sucks up all the creatine from the blood, the brain has the blood-brain barrier and it says, whoa, we don't need what's in the bloodstream. We make our own until the brain is stressed. And so what we're starting to see is that when the brain is stressed, there's a common denominator. Their baseline creatine stores are reduced. And some of the populations that have that is clinical depression, anxiety, PTSD, concussion would come to mind, or sleep deprivation. And when you use a magnetic resonance imaging, or MRI, there's a device on that MRS that will measure creatine accumulation in the brain. And creatine supplementation will eventually get in the brain, but it takes either a higher dose or a longer period of time, several months. So that's personally why I've increased my creatine from the 3 to 5 grams a day up to 10. I'm kind of now looking, I'm 47 years of age. I'm looking at it from a muscle health perspective, bone health, as well as a brain health perspective. We think that's basic math, 3 to 5 grams for muscle, about 8 for bone, and maybe a little bit higher for brain. But you probably don't need any more than that. And that's the theory, unproven. We haven't done a dosing study, but that's the theory behind that.
So let me ask you a question. And why would you, besides being a creatine researcher,
Yeah.
would you take the dose now, unless there's something like a deficiency, or maybe you're a lot of stress or things like that, beyond the weightlifting, and maybe save? Often my own perspective often is I want to use something like creatine regularly, but I would almost like wait until I am deficient or aging, or needed that boost. Whereas while I'm younger, I'm 43, I normally would only take it if I was leading up to a competition or something like that. What do you believe what's your recommendations for the common person who is in good health, doing okay? Do you think they should take creatine, or should they save it for maybe aging or something like that?
Yeah, so this is really important. Creatine supplementation is not required at all. We naturally synthesize it, unlike a protein. But you can, the weight of evidence is suggesting a smaller, greater amount, more than what we're eating in the diet and or synthesizing, can have some favorable effects. The effects are not that great. Like if you think you're taking creatine and it's going to act like steroid-like principles, please note that's not the case. It's very similar to protein. I always say resistance training is the cake. The protein is the nice icing, and the sprinkles on top would be creatine. You're going to get maybe some small effects, but not a lot. Now it comes to mind, that's a really interesting analogy to deplete your creatine in your muscle. Maybe you go on a vegan diet for a month and then hit it hard, kind of like carb loading before a marathon. That is a good theory. I've talked to people in Belgium about that, and they think that could have some
Where like super compensates?
super compensate. And that's leading up to it, a lot of people will, carb deplete and then load. That's a theory
Yep.
there as well.
Okay.
Again, our tissues only have so much, and that would be a very interesting study for sure. Yeah.
Okay. Then may I ask you, how come you take 10-gram dose? What is your
I
main?
take, yeah, so I'm usually cognitively all over the place, from an academic perspective. My sleep is usually interrupted, but I try to get adequate amounts. I don't eat red meat anymore for personal reasons. I do
Okay.
eat a lot
Okay.
of
So that makes sense then. Okay.
As we get older, we now know that a slightly greater amount, but I've been taking it consecutively for decades. Like people thought, should we cycle it? We don't know if you need it or continuous amounts. The argument, the counter argument in a debate would say, well, your muscles are already full. Why are you taking the 10 grams? My hope is some is going to my brain and
Right.
bone. But again, until those studies are done, we just don't know. Yeah.
One of the interesting topics that's come up recently, obviously with Ozempic and all that, one
Yes.
of the things that made me interested in creatine and see it from a different angle than I've thought before. I'm really big on recommending, obviously, people eat enough protein. Like I said, we have a healthy weight loss program, so we're trying to get people to do it in the healthiest way possible, control their hunger hormones, preserve muscle mass, especially as they age with their weight loss. So creatine is interesting in that regard. Do you see a benefit in creatine for preventing muscle loss during weight loss? And then secondly, is there any research going into how popular weight loss drugs are and the massive amount of muscle loss that's coming with drugs like Ozempic and maybe preventing that?
Yeah, those are excellent segues and something I've thought about a lot. So the hypocaloric diet, it's well known now for individuals, bodybuilding, UFC, whatever it is. When you go on a diet and you increase your protein, the protein will hopefully maintain or at least preserve some of the muscle. But creatine has been shown to have some really good anti-catabolic properties as well. So one of the best studies to do upcoming is those on a cutting or diet. If they increase their protein, could creatine help maintain some of that muscle or even increase muscle more? And I think there's some potential there. So that would be a great study to do. I think the biggest from a global perspective is all these with Ozempic or the GLPs, they're losing phenomenal amounts of weight for longevity and health purposes. But one of the side effects is they're losing lean tissue. And creatine's been shown now to preserve the loss of lean tissue and immobilization, some bed rest studies, and potentially with anti-catabolic effects. So a big global study would be interesting to look at people on Ozempic or semaglutide and take creatine. Maybe they still lose fat mass and body mass, but maybe they maintain muscle, which would have huge implications for functionality. So that would be a very expensive study, but I think it would be very worthwhile and something I'd be very curious to see the results.
I'm assuming no, but any concerns with the digestional distress from Ozempic combined with something like creatine and its absorption or no?
No, I don't see any interruption. I mean, creatine is pretty much has 100% bioavailability,
Okay.
even from a powder perspective. And once that molecule will get in circulation, it will have different pathways. And of course, creatine is unique. It has specific doorways that will allow it into cells. And if the doorways don't open, we just excrete it. Yeah.
Let's get into specifically then the source and dosing. You've
Yes.
alluded to higher doses for health, lower doses are needed for just, muscle performance. And then also the sourcing. I've heard a lot of things about Pure, creatine from China versus from Germany.
Yeah.
What do you recommend when people talk to you about that?
Yeah, so when I say creatine, I'm only referring to monohydrate. There's a lot of other marketed forms out there that are just not supported by evidence-based research from a safety and efficacy profile. So again, for when I say creatine, I mean monohydrate. That's just creatine linked to water. So any monohydrate that you would see, if it's third-party tested, 100% pharmaceutical grade creatine, it should be all the same. Creapure is one of the best types of creatine produced out of Germany. It has a lot of really strict guidelines for manufacturing. So I can only talk about that as well. From a dosing perspective, as you mentioned, you can go as little as 3 to 5 grams for muscle and work your way up. The cool thing is you can take it in a bolus or split up the dose, however it is achievable for you. And the timing doesn't matter. You can take it in the morning, during your workout, or in the evening. So it's something that doesn't take a lot of work, and where the timing doesn't matter. You can sprinkle this in your yogurt, in a shake, whichever you want, if you can't get it through your diet.
So do you see any benefits in mixing it with glucose, protein? I know you mentioned there's a synergistic effect with protein. With real meals, anything like that that improves anything
Yeah,
or?
I always like to do food first, but if you're taking a supplement, you probably might get some greater advantageous effects to mix it with protein and or a small amount of carbohydrates. The dose of carbohydrates needed to really augment is physiologically high, and a lot of people don't want to have the simple sugars anymore. But protein is great. It's gluconeogenic. You get all the benefits from protein as well. But one of the coolest ways to get creatine in greater amounts in your muscle is exercise. So prior muscle contractions turn on these doorways that allow creatine in. So one of the coolest times to take creatine is post-exercise.
Okay. So it's much, the muscle cells are sensitive, much like as the way they would be to protein or glucose, much the same way with creatine.
That's 100% correct. It's very similar. Yeah.
For creatine monohydrate, you mentioned, I know there's like these all different types of creatines.
Yes.
Research is all around creatine monohydrate, but even within creatine monohydrate, you'll see things that say like instantized or micronized. Does any of that mean anything or is just
Yeah, the ultra micronized is just refined. So a lot of people say they didn't like the grittiness at the bottom of the glass, or it got a little gritty in their mouth. That's all it is. They're just basically micronizing it over time. The bioavailability, where creatine monohydrate is around 100%, can't really fluctuate too much. And at the end of the day, if the bioavailability is there, the efficacy would be the same. Yeah.
I want to sum up a little bit of what you had here and see if you agree.
Okay,
So
sure.
totally healthy, everything's good. Creatine is not a supplement you believe people need to take.
Right.
Okay. If you're doing it for performance, you can do it for lower doses. There's no signs of any issues at this time for long-term use. And it could be anywhere like that 3 to 5 grams steadily. Probably more beneficial to people that are vegan,
Mhm.
aging, don't eat a lot of meat or fish,
Correct. Yep.
would benefit more from it.
That's correct.
And then if we wanted to improve lifestyle or potentially get those benefits for sleep deprived, highly stressed, that dose would be closer to 10 grams or maybe even above.
Yeah, 5 to 10 grams it will accumulate once the muscle's full, and that's correct as well. Yeah, that's where the current line of thinking is. Yeah.
Okay, so then if someone was just asking you and said, hey, who should take creatine? And I know this is just, you're not a doctor, you're not
Yeah.
just based on your research and high level, who should consider creatine then definitely?
Yeah, the evidence-based research says that pretty much anybody, including children, there's some benefits from a sport and agility perspective. And the only individuals we have a little bit of caution is pre-existing kidney or liver abnormalities. You want to talk to your doctor as well as there. And again, if you're on a carnivore diet, I would not expect hardly any noticeable benefits. And those are the areas of the individuals. But there's a lot of upswing with very, very minimal risk. But again, if you have some medical condition, please talk to your doctor on that as well.
Last question I have for you is what are you working on now and what are you most excited about going forward with creatine research?
Yeah, we have a lot going on, but we're super excited to look at the effects of does a bolus versus intermittent dose of creatine have any detrimental or hindering effects? And we're looking at older adults. We're looking at the timing to finally put the sort of nail in the coffin, if you will, on this timing idea. And then I'm collaborating with a lot of individuals internationally looking at female health. So what about young females? What about the perimenopausal transition? And then we're really starting to focus on dementia and looking at the effects there as well. So stay tuned, and hopefully the next few years we'll have some really good, interesting new data to come out on that as well.
So you mentioned two things. I just would like to add a
Yeah.
question. Perimenopausal, what do you suspect would be the greatest benefits for women in that age group?
I'm hoping that it will improve functionality, muscle performance, and hopefully actually have some bone beneficial effects before the cessation of estrogen takes on. If we can slightly enhance those areas, then obviously when the mountain, if you will, of the skeleton starts to decrease, we've actually built that up more. The other very fascinating areas, there is some evidence that when you go through the perimenopausal transition in the menopause, some individuals have a heightened risk of depression and anxiety, like the mental aspects that go with that. And creatine is now starting to show promise there as well. So that's some of the new emerging areas. Can creatine have some cognitive or self-esteem or mental aspects? I think that could be really important moving forward.
Is there any effects related to that? Just because that time is such a flux of hormones. Is there any effects on hormones specifically from creatine as far as androgenic or anything like that?
We see some beneficial effect on growth factors like insulin, like growth factor 1. It's been shown in serum to decrease myostatin, the muscle regulator, but nothing from like a big testosterone or estrogen fluctuation, especially it's just on growth factors. So it really has no effect on the endocrine or exocrine system per se.
And then the second part of that was the aging that you mentioned in some of your research. Is it believed that the greatest benefit may be energy, function, prevention of bone loss, prevention of muscle loss? Is that where it's
Yeah,
going?
in combination with exercise. Like if you don't exercise, you're not going to get any of these benefits from
Right,
a
right, right.
long-term perspective. So it can just sort of help maintain the motivation and allow you to maintain exercise. Yeah.
Because standard performance improvements are what, anywhere between 8 to 15%? Is it something like
That's
that?
correct, primarily from a muscle strength perspective. There's been a handful of studies with no exercise component in the study, and creatine has been shown to improve muscle performance. So I think one of the biggest things for those listening, creatine is well documented to improve muscle performance. Like you should expect either strength, endurance, or power to go up if you're performing exercise compared to placebo. And that's probably the greatest weight of evidence around that areas.
What do you got going on as far as how people can find you, see your research? You got a book coming out, something?
No book yet, but I think Instagram is where everybody goes right now. So at Dr. Darren Candow, I try to post all new research, not just my own, but all the stuff that comes out. I'm speaking at the ISSN conference in June to look at the evolution history of creatine, which is very interesting how it's evolved. I'm very excited. So if people want to follow me there, I try to post a lot of the research that's coming out and future ideas.
Awesome. I really appreciate your time.
Thank you. Yeah,
And I look
great.
forward to seeing, you might get a bunch of questions from me now behind the scenes as people reach out to me. So
Yes, and please do. I know just message me and that'd be great, but thanks so much for having me.
awesome. Thank you so much.